is Alana Murphy, and I am the president of the Bartlesville Education Association. We recently polled our members to gain a deeper understanding on the impact that COVID-19 is currently affecting our classrooms across our district. We had 97 of our 186 members respond to the survey, representing educators from every school building in our district. Teachers responded ranging years of service as a rookie teacher through 40 years in classroom. When asked about masking in the classroom with medical and religious exemptions regardless of vaccination status, while in the red and orange alert status, 56% of those polled were in favor of masking adults in the classroom. The same percentage of members supported a mask mandate, like a reinstatement from last year, for students in grades 3rd through 12th with medical and religious exemptions honored regardless of vaccination status. When asked if they felt that requiring students to mask would be an issue to enforce, 61% of our teachers said yes. However, if you break down those that said yes, 26 are secondary teachers and 30 were elementary teachers. Despite acknowledging that enforcement may be a challenge, they are still in favor of undertaking this chore if it ensures that our classrooms are safer for all involved. In the comment section, several of our elementary teachers pointed out that masking is really the only line of defense for our elementary students that are too young for vaccinations, and class sizes and the students' own lack of awareness of personal space lead to more difficulty social distancing. The survey also found that 33% of our teachers responding were unaware that the district was providing free testing. BEA will do our best moving forward to make sure that information is available to all staff and who to contact to be tested if they have been exposed on campus. Many teachers I have spoken to have been appreciative of the district providing this testing for our staff. I want to take a minute to personally thank Gary Eichelberry and Lisa Foreman for coordinating these services for our staff. Many have let me know how kind, professional, and caring they both have been when they have contacted them with concerns and during the testing process. We appreciate everyone working on the pandemic response committee as well, listening to feedback and helping our district navigate through this difficult time. Tonight I'm not here to demand any change or else. Tonight I'm here to make sure the voices in our classroom are being heard. Those currently serving students are given a platform to be heard. Many people that are teachers do not feel comfortable talking to their building admin about this. Their teammates on their grade level teams are speaking out individually just because of how divisive this topic has become. However, it is my duty to bring their concerns to light in front of the Board of Education and our administration team. Many teachers, the majority of those who responded to our survey, are in favor of reinstating the mask mandate for staff and students when we are in the orange or the red zone with the state-required opt-out features. We feel that this is a layer of mitigation that we must do in our daily battle against COVID-19 in our classrooms. We want to be in person with our students, we want them to be safe, and we want our colleagues that we teach along to be safe as well. If you have any questions about our additional survey results, please reach out to me in my email. The survey is confidential, but we can respond with more data if you request. Thank you.
Thank you, Ms. Murphy. Don't know, do we have anybody here representing the Bartlesville classified personnel? Okay, we'll move to the next blue card, or the first blue card. Anna Garrett. And if you want to make your way, either one of the two microphones are available as each of them come forward to speak.
Hi, my name is Anna Garrett. I work at the high school and I teach English here, 9th grade. First of all, I just want to thank you guys for giving me the opportunity to speak here and everyone. I want to thank you guys so far for not enforcing a mask mandate. I'm not going to take this time to try to convince anyone about, or to change anyone's mind about the mask or quarantines or any other aspect of how to handle this. But since the data is already out there, and we probably all already have a personal opinion about that. However, I am going to tell you my personal experiences since this has happened. This is only my 5th year teaching. I'm still considered a rookie. Out of all the years that I've taught, last year was the hardest. I think there were a lot of factors that went into that, and I think that our district handled it really well, actually, or well, I shouldn't say actually, I mean, I expect that from Bartlesville School District. But I will say that it took so long to make a connection with my students last year because of not being able to see their school or their faces. I think that I know that it's essential for child development, even for high schoolers, to see facial expressions. It's harder, just, you know, logistically, it's harder to hear my students, it's harder for them to hear me. Just as a human being, it's hard for me to wear a mask and teach, or even the face shield. I experienced a lot of anxiety when I was teaching, and I can't really explain that except that it's just a biological response that I had to it. I can say that from my personal experiences, my students in the spring, whenever the mask mandates relaxed, and it was a personal choice, a lot of students came to me and told me that they were elated because, you know, for the first time in a long time, they felt like they could breathe at school. So I'm just going to end with thanking you guys again, and I want to just ask you all to listen to all stakeholders, not just teachers, not just you know, people in the community who actually have a stake in it, who have students in the schools, students themselves, and that's all I can ask you all. Thank you.
All right, thank you. Next on the list is Julie Mercy.
Thank you, Board. I've been here one other time, it was early on, and all I can do is say I'm proud to be a Bruin mom. I'm proud of the Pandemic Response Committee for doing the best that they possibly could, and I'm proud of your decision to go ahead and support the Senate bill and the freedom that we have to choose. I'm a registered nurse. I've been a registered nurse for 28 years. I actually had an opportunity to be on the COVID floor on the second floor of Jane Phillips Medical Center 2 weeks ago, and I can tell you that none of the masks that are being worn in this room are the masks that the nurses are wearing on COVID response floor. The masks that they have are fully enclosed. They are fitted to each one of those nurses. They have filters on both sides, and basically they have to get in the face of their patients and practically scream. I witnessed it firsthand with a patient who was over almost 90 years old, and it was really detrimental to him. I was glad to sit at his bedside and be there so he wasn't alone. So I'm speaking because I love this school. I'm a nurse, I love people. I've been to Haiti, I've served, you know, where dengue fever is high risk. I will serve till the day I die. I do feel that the remarks I'm going to read tonight are from teachers that don't feel like they can speak out. They feel intimidated, and I know that's not our culture here at Bartlesville Public Schools. I think it's a culture by a subset, and I don't think it represents the majority. I do know that this is a virus, and it will take the lives of people. I'm not going to deny that it kills people. That's not to be debated. It's unfortunate. And so I don't want to be called an anti-anything. I'm not one of the antis in the room. I'm one of the pros. I'm pro-BPS, and I'm proud to be a Bruin mom, and I'm proud that my children go here. So I have some teacher statements, and I'm just going to read verbatim. They were just sent in an email, and the first one is from teacher number 4. The statement reads, Bruin. I've always been proud to be a Bruin and still am. Our district has done a phenomenal job at navigating our ship throughout the COVID-19 pandemic. Myself and many others have been incredibly proud of our district for adhering to Oklahoma law regarding masking. After the passage of Senate Bill 658, students and teachers alike are no longer allowed to be required to wear a mask. Speaking from the perspective of a teacher, I cannot begin to tell you the amount of joy I've experienced with my students just by seeing their faces. With over 600 students in our building and a 40+ staff, it's very clear masking is not preferred. I would roughly estimate you see approximately a total of 20 students and teachers wearing masks. This is a choice of theirs that is entirely respected in our school. I'm so incredibly grateful our district continues to allow us to make these decisions for ourselves and our children. After surviving a full school year amidst the COVID-19 pandemic, I came to realize how detrimental the masks were for our children. Many who wore glasses, including my own child, had difficulty seeing through their fogged lenses. Many began having skin problems and increased acne due to the mask. Breathing was a very large complaint and led to hands being increased and placed on their mask to either lift or pull them down to get their breath. My biggest concern is the genuine fact that masks can be vectors for pathogens if they are moist or used too long. A recent study was conducted in Florida where a lab these masks were sent off at the University of Florida and were tested for pathogens on 6 students' masks. This was a parent-led research. 5 of those masks were worn by 6 to 11-year-olds for 5 to 8 hours of school and 1 adult. 3 were surgical, 2 were cotton, and 1 was a polygator. After examining the masks, 5 out of 6 were found to be contaminated with parasites, fungi, and bacteria. 1 mask had a virus that caused a fatal systemic disease in cattle in deer, while others had an pneumonia-causing bacteria identified, strains of meningitis causing bacteria, and more. Aside from, I have that study that I can hand to you, Superintendent. Aside from these concerns, I also fear for our children's social, emotional well-being. Facial expressions are integral to human connection, especially for our littles. Covering our faces essentially mutes those facial expressions and in turn creates confusion, anxiety, and more. For those of us who teach or have taught in primary grades, we know how important it is for our students to see us speak. Being able to see others speak is a building block of phonetic development. The recent injunction placed on Senate Bill 658 is concerning to say the least. Viewing this injunction through the eyes of an educator is very stressful for me to follow. I was very proud to hear our Pandemic Response Committee felt this was not the right thing to do for our district and to wait on the legal proceedings. As they already know, to enforce such a mandate would be exceptionally difficult in a time where it is not needed. Trying to manage masking exemptions, and I have 2 more comments by 2 teachers, again, that didn't feel like if we can stand up here tonight and speak. I just know that's not the culture that we want to represent, so I'll leave this with the...
Great. Okay, next is Leslie Kramer.
Good evening. When we first encountered COVID, Bartlesville Public Schools became a leader in getting our students back in person as quickly and safely as possible. We allowed parents to make individual decisions for their students about in-person or virtual learning, or a combination of the two. I was and am proud of how we handled this situation, and many parents who had students in other districts during that time were jealous of how well we handled things and wanted desperately for their district to follow suit. I know this because everyone who knew or found out I teach here made sure to let me know. Recently, I listened to an interview of State Superintendent Hoffmeister regarding masks in public schools and specifically regarding Senate Bill 658. In this interview, Ms. Hoffmeister states, quote, "Most students and staff want to wear masks in school. This statement is erroneous and misrepresents the truth to the media and public. I know this because I see students at the high school on a daily basis, and I've talked with my own daughter about how many students in her class wear masks. So, after hearing that statement, I conducted a simple convenience sample of my students to determine if most is an accurate representation. Of my 126 students, only 9 of them wear a mask to school, and that equates to 7.1429% of my students. According to Webster's 1828 dictionary, most is defined as consisting of the greatest number or consisting of the greatest quantity. With that definition, 7.1429% would hardly be considered most. While we can all present and interpret data from valid and reliable sources to support our thoughts, beliefs, and opinions regarding masks, knowing approximately 92% of students at VHS choose not to wear masks speaks volumes in regard to what the majority of our parents want for their students. As a parent and a teacher, I'm very thankful Governor Stitt led in taking a stand against mask mandates in public schools in our state. I've read 658. At no time was a decision made to prevent the wearing of masks by those who still choose to do so. Instead, 658 made it possible for those who do not want to wear a mask to make that choice for themselves and their children. Alternatively, a mask mandate takes away that choice. As our district considers how to handle masks, we have another opportunity to lead. We can lead by continuing to allow our parents to make their own educated decisions regarding masks for their own students. We can lead by allowing staff to make educated decisions as well. Thank you.
Okay, next up, Liz Cohn.
My name is Liz Cohn, and I was educated here in Bartlesville. I've lived here all my life. 5 children that graduated from here, and I now have the honor of teaching. I have some more teacher statements to read. I'm writing, this is teacher statement number 11, I'm writing to say that we should not require another mask mandate. Let the data in our schools talk for itself. We're getting ready to start week 7, and our district tally sheet shows there are only 2.4% of staff and students for the entire district out due to COVID quarantines or positive cases. I think that is amazing, and it would be silly to go back to wearing masks for such a small percentage. Mental health. First, I will speak for myself. I went into last year, as did all of my peers, not knowing what to expect. I wore my mask because I was told I had to. I was told by many there was no way we could make it the whole school year. We did not know what to expect from anything, and yet we showed up every day and put our lives possibly at risk each day. I looked out at my students every day and only saw their eyes. They were quieter than ever before. I did not build the connections with them like previous years. They came in, took notes, and walked out, some rarely speaking a word during class. Then, at the end of the year, we were allowed to take off our masks. My world was so much better that day. I saw them smiling, and they saw me smiling. I realized that the feeling I was going through was depression. I'd never experienced anything like it before, so I just thought it was me. But it instantly went away, and I immediately knew the cause of it. I truly do not want to go back to that place, especially when the data does not support it. As for my students, they are so much happier and more excited about school this year. They participate more and they interact with one another more than last year. There is such a better vibe in the classrooms, in the halls, and at events. Last year there were more suicide attempts than I had ever heard of before in my years of experience. I had many students tell me they were seeing counselors outside of school because things were just too much for them. Lastly, I don't see where our district would require masks when people are allowed to wear masks if they feel the need to do so. If you were to come in our school, you would notice very few staff and students wearing masks. If you go to a sporting event or any extracurricular activity, you would see very few people wearing masks. I think this shows that the majority is not for wearing masks. Sincerely, a BPS teacher. Teacher statement number 7. Teachers and students who choose to wear a mask are wearing them already without question or pushback, just as those who have chosen to be vaccinated have done so. It's plain to see that the majority of staff and students are against wearing masks at school. I'm dealing with severe behavior issues in my class, and masks are yet another distraction the rules have to enforce. A BPS teacher. Teacher statement number 8. I'm against masks because they hinder breathing and they don't work. Also inside the classroom, they are a hindrance. In lower grades, it's important for students to see the teacher's mouth and for teachers to see the student's mouth when speaking. Masks get lost and teachers become the maskers instead. Teacher statement number 9. I teach very young students, most of them are 4 years old. It's so important for my students to hear my voice clearly and see my face. This is one of the many reasons why I'm against masking. Last school year, when I taught in a mask, I found it almost impossible to effectively communicate with my young students. They need to be able to look at my formation of my mouth in order for them to learn sounds. I tried wearing a face shield in hopes they would see my face and lips, but they had a hard time hearing my voice in the shield. It was a constant battle and burden when trying to communicate to my students. When wearing a mask or a face shield, I had to speak louder than I would have liked, which often resulted in a sore throat by the end of the day. Talking nonstop for hours in a mask is a cruel thing to do to a teacher. I was straining my voice out of breath at times and suffered from irritation in my face due to masks. I realize not everyone had these negative effects from wearing a mask, but this was my personal experience. The benefits of not wearing a mask heavily outweigh the benefits of wearing one, in my opinion. I believe masking inhibits children's social development because children may have a harder time reading facial expressions of their peers and teachers. I feel that covering up faces of students or teachers is not beneficial to a child's development. Communication is vital in everyone's life. Masking makes it a challenge, especially for young students. I also believe that having a requirement to wear a face mask violates the United States Constitution. We live in a free country. The decision of wearing or not wearing a mask is a health choice that should only be made by the individual. I can make this decision on my own. There is data that supports masking, and there is data that supports not masking. This is why this decision should be left up to the individual, not forced upon anyone. I do not want to teach in a mask again. I do not think they're worth it. People who wear a mask still often contracted the virus. I have had COVID-19 before, and I prefer to have it again than be trapped teaching behind a mask. Sincerely, a BPS teacher. Thank you.
Okay, next, Jonathan Volpe.
Thank you. I'm Jonathan Bolding, board members, superintendent. The physical properties of medical and non-medical face masks suggest that face masks are ineffective to block viral particles due to their differences in scales. According to the current knowledge, the virus SARS-CoV-2 has a diameter of about 60 nanometers to 140, or about 0.1 micron. That's a billionth of a meter, which is more than, let's see here. While medical and non-medical face masks thread diameters range from about 55 to 140 micrometers. So it's about a millionth, which is more than 1,000 times larger. Due to the differences in sizes between the SARS-CoV-2 diameter and face mask thread diameter, the virus is 1,000 times smaller. SARS-CoV-2 can easily pass through any face mask. In addition, the efficiency filtration rate of the face mask is poor, ranging from about 0.7% in non-surgical cotton gauze woven masks to 26% in cotton sweater material. With respect to surgical and N95 medical face masks, the efficiency filtration rate falls to about 15% and 58% respectively, when even small gaps between the mask and the face exist. Clinical scientific evidence further challenges the efficacy of face masks to block human-to-human transmission or infectivity. So it is not clear what the scientific and clinical basis for wearing face masks as a protective strategy is, given the fact that face masks restrict breathing, causing hypoxemia and hypercapnia, and increase the risk of respiratory complications, self-contamination, and exacerbation of existing chronic conditions. Breathing is one of the most important physiologic functions to sustain life and health. The human body requires a continuous and adequate oxygen supply to all organs and cells for normal function and survival. Breathing is also an essential process for removing metabolic byproducts of CO2 occurring during cell respiration. It is well established that acute significant deficit in O2, hypoxemia, and increased levels of CO2, hypercapnia, even for a few minutes can be harmful and potentially lethal if continued. So what is hypoxemia? It is below normal level of O2 in your blood, specifically in your arteries. We are mammals, and as such, we require a certain volume of oxygen to maintain homeostasis. So what happens if we shift to a higher anaerobic energy metabolism, without anaerobic, meaning without oxygen? What happens to homeostasis? The following can occur: decrease in blood pH levels, an increase in cell and blood acidity, toxicity, oxidative stress, chronic inflammation, immunosuppression, and the health deterioration. So how much oxygen should we be breathing? An average tidal volume is about 0.5 liters, or about 300 to 500 milliliters. So what is hypercapnia? Hypercapnia is when you have too much CO2 in your bloodstream. It usually happens as a result of hypoventilation or not being able to breathe properly and get oxygen into your lungs. Long-term practice of wearing face masks has strong potential for devastating health consequences. Prolonged hypoxic and hypercapnic state compromises normal physiological and psychological balance, deteriorating health, and promotes the developing and progression of existing chronic diseases. Psychologically, wearing face masks fundamentally has negative effects on the wearer and nearby persons. Basic human-to-human connectivity through face expression is compromised and self-identity is somewhat eliminated. These dehumanizing movements partially delete the uniqueness and individuality of the person wearing the face mask, as well as the connected person. Social connections and relationships are basic human needs, which are innately inherited in all people, whereas reduced human-to-human connections are associated with poor mental and physical health. Encountering people wearing face masks activates innate fear emotion, which is fundamental to all humans in danger or life-threatening situations such as death or unknown, unpredictable outcomes, while acute stress response is adaptive reaction to challenges and part of the survival mechanism. Chronic and prolonged state of stress fear is maladaptive and has detrimental effects on physical and mental health. The repeatedly or continuously activated stress fear response causes the body to operate on survival modes, sustaining an increase in blood pressure, pro-inflammatory state, and immunosuppression. The failure of the scientific literature to support medical masks for influenza and all other viruses is why Fauci, the U.S. Surgeon General, the CDC, and the World Health Organization, and pretty much every infectious disease expert stated that wearing masks won't prevent transmission of SARS-CoV-2. Although the public health authorities reversed their positions and later changed their recommendations, the science did not change, nor did new science appear that supported the wearing of masks in public. In fact, the most recent systemic analysis once again confirms that masks are ineffective in preventing the transmission of viruses. Thank you.
Next up, Joe Williams.
Rarely are there times in our lives when a decision we make will have life and death consequences, ourselves, our families, and our community. We are in one of those times due to COVID and the Delta variant. This has put the school board and administrators in one of these rare decision-making situations. It's not what you signed up for, but it's the hand you've been dealt. Good evening, my name is Joe Williams. I'm a management consultant, longtime advocate on the public education in Bartlesville, on the board of PEAK, a volunteer hurdle coach for the high school track team, and a proud parent of 2 and grandparent of 4 BHS graduates. A group of community leaders, school supporters, local physicians, and a frontline nurse will speak with you tonight to support and encourage you to pass a mask mandate. I'd like to set the groundwork for what is to follow. We know that a vote on masks is not on tonight's agenda. We hope that after hearing our argument for masks, that you will move sooner rather than later to do so. We have worked with the schools in the past on everything from bond issues to the teacher walkout. We are supporters of the school and of the work that you do. We are here for you, not against you. Last year you mandated masks and obtained PPE equipment. This year you're installing state-of-the-art ventilation system. We applaud those initiatives. As a board member, your fundamental responsibility is to protect the health and safety of students, teachers, and staff, and you have been diligent in doing that. Now we believe it's time to do one more thing in your control, and that's to pass a mask mandate. We see by Granger's daily charts that the number of cases in the schools is dropping, and that is certainly encouraging, but the numbers are still in the red zone, and while the trend is downward, it can easily go back up, especially with more indoor activities in the coming of winter. We believe that now is the time to actually be more aggressive to further reduce the numbers, and that can be done by passing a mask mandate. By doing so, it will greatly lessen the burden on our healthcare system. We all want students in school, and we all want students in school without a mask. That's what everybody wants. But because the vaccination rate is so low in our county, in our district, masks are the only line of defense against the Delta variant. Mandating a mask policy would align ourselves with many other school districts that have already done so. And we have to ask, why are we not doing as well? More importantly, staff and teachers at every level should be wearing masks to model leadership and to show that they are truly encouraging students to do the same, because students look to their teachers as role models. We can all speculate on what the opt-out numbers here might look like and might be, but other districts are really finding them to be quite low. Oklahoma City found out of 32,000 students, they had 149 opt out. Union has had 5% of their population opt out. And surely our numbers would be somewhere in between that. Heather Boyle, who is now at Union, wrote me that prior to the mandate, only 3 of her 18 fourth grade students regularly wore masks. Now that the mandate is in effect at Union, 17 of those 18 students are wearing masks like it's no big deal. Enforcement is really a matter of execution and leadership. Teachers tell me that they receive coded attendance reports for each class, so there could simply be a code added to that for those who do opt out. Every problem has a solution, and I'm sure that the administration can certainly figure out how to do that. Our school system is the 4th largest employer in the city. Every large employer has a mask mandate. As a board, we urge you to do the same. Whatever you decide to do or not to do regarding masks, know that it will have a direct effect on the hospital, and the healthcare professionals in our community. If any of us can help you with this process after a board meeting or any time, we would be more than glad to help be part of the solution. When my oldest son was in 2nd grade, he asked the principal if she had any children. She held her arms out wide and said, "All of you are my children." At the end of the day, there is but one question to ask yourself as a board. Have I done everything in my power to protect those I am responsible for? Have I done everything to protect all of my children? I ask that you let that guide you when you make decisions. Thank you very much for your time.
All right, next, Kyle Craig.
Good evening, Superintendent McCauley, school board members. I'm Dr. Kyle Craig, family practice obstetrics physician here in Bartlesville, and I have 4 children in Bartlesville Public Schools. First of all, I want to take this opportunity to thank you for setting a standard of excellence in educating our kids. You have been one of the organizations in our community that promptly responded to this pandemic by following expert guidelines and science, which ultimately proved to allow our kids to return to in-person school exactly where they need to be. I'm here tonight, along with our other colleagues, or some other colleagues from the medical community and other community and parent leaders, to help all of you better understand the severity of our most recent surge in COVID-19 infections. It has proven to be the worst of any of this pandemic thus far for the hospital. We had an overwhelming amount of emergency room visits and hospital admissions, in addition to deaths of COVID-19. Unfortunately, this surge has also had a significant impact on non-COVID related medical emergencies and services. Our county COVID-19 vaccination rate is among the lowest, not only in our state, but also in our country. Because of this low vaccination rate, we must continue to find ways of lowering transmission to the unvaccinated population in our community that are at risk for these hospitalizations. One of those practices is masking. Last year, the schools, because of your leadership, were able to institute a mask mandate, and I'm asking you to consider requiring masks again among students and staff, since our vaccination rates are so low. I want all of you to know COVID-19 vaccines are safe and effective. The vaccinated population continues to have very, very low numbers of hospitalizations and deaths, while the unvaccinated population represents well over 95% of COVID-19 related hospitalizations. The COVID-19 vaccines are currently approved